Before we dive in, just a quick note for you. This explainer is based on a chapter from the book Maza Madume Maze Niantran. Now, if you'd like to go even deeper, you can find a lot more detail over at schoolfordiabetes.in.
Hello and welcome. Today, we're going to tackle a huge topic, one that affects millions of people, diabetes. So what is it really? Well, the World Health Organization calls it a disease of metabolism. Now that might sound a little technical, but all it really means is that something's gone wrong with the way our bodies turn food into energy.
To really get it, let's start with a simple thought experiment. Imagine your body has a master key, a key that unlocks all the energy from your food. Now, what happens if that key suddenly stops working? This one idea, right here, is at the very heart of understanding diabetes.
Okay, so here's how it's supposed to work. It's actually a pretty elegant system. First, you eat something. Your body gets to work and breaks that food down into a simple sugar called glucose. Then, this glucose travels through your bloodstream, ready to deliver fuel to every single part of you, from your brain to your muscles.
But there's a catch. That glucose can't just barge into your cells. It needs that special key we were talking about. And that key is a hormone called insulin. Your pancreas makes it, and its one and only job is to unlock the doors on your cells to let that fuel, that glucose, get inside.
So, it all boils down to this simple lock and key system. In a healthy body, the insulin key fits perfectly into the cell's lock. The door swings open and the glucose rushes in to provide energy. Perfect. But with diabetes, the whole system breaks down. Either the key itself is missing or the lock is jammed and won't turn. Either way, the result is the same. The door stays shut and all that glucose gets trapped in your bloodstream. That's what we call high blood sugar.
You know, it's amazing to think that for most of history, we had no idea about this key. Doctors just saw the symptoms. But then in 1922, everything changed. Two researchers, Dr. Banting and Dr. Best, did this groundbreaking experiment and proved that the pancreas creates a special substance that stops diabetes in its tracks. They gave that substance a name, insulin. And just like that, the game was changed forever.
And that discovery is crucial for understanding the two main types of diabetes. With type 1, which makes up about 15% of all cases, the problem is simple. The body's insulin factory, the pancreas, shuts down. The key is just gone. But with type 2, which is the other 85%, the body is still making insulin keys. The problem is that the locks on the cells are rusty or broken, and they just don't work properly anymore.
All right, so now we know the what and the how. But we need to talk about the where, because this isn't just a science lesson. It's a story that is unfolding right now on a massive scale, especially in India. It's been called a modern health tsunami.
And that's no exaggeration. Just look at this number. Right now, 1 out of every 14 people in India has diabetes. Let that sink in. This isn't just a statistic. It's a massive public health challenge affecting families and communities everywhere.
Which of course leads us to the biggest question of all. Why? Why is this happening on such an enormous scale?
Well, a huge part of the answer lies in something fascinating, a kind of genetic mismatch. See, many of us have what are called hunter-gatherer genes. These are ancient genes that are brilliant at storing fat and energy, which was a lifesaver when food was hard to find. The problem is that ancient programming is now clashing with our modern world, where food is everywhere, and we spend a lot more time sitting down.
Okay, I know all of this information probably brings up a ton of questions, so let's just jump right in and tackle some of the most common ones that people have.
First off, what should you even be looking for? Well, some of the classic signs are things like needing to urinate a lot because your body's trying to get rid of the extra sugar and feeling incredibly thirsty. You might also notice weight loss even though you're eating normally or just feeling weak and tired all the time. But here's the really important part. Sometimes, especially with type 2, there are no symptoms at all, and it's found by chance during a routine checkup.
So when we talk about who's at risk, it's helpful to split things into two groups. On one side, you've got the things you can't change, right? Like getting older, your family history, and that Indian or Asian ethnicity we talked about. But then there's the other side, the things you absolutely can influence. We're talking about your weight, your blood pressure, how active you are, your cholesterol, and whether or not you use tobacco.
This brings us to a huge myth that's out there. People often think, oh, diabetes is only something that happens to people who are overweight. Is that really true?
And the answer is a big, clear no. Because of that genetic predisposition, the risk is there for so many of us. Yes, having a high BMI dramatically increases your risk for type 2, for sure. But thin people can and do get diabetes too.
thanks to that mix of genetics, stress, and maybe a lifestyle with low muscle use.
All right, let's tackle the other big one. We've all heard this a million times. Stop eating so much sugar or you'll get diabetes. But is it really that simple? Did that one piece of cake cause it? Well, it's not a direct cause and effect like that. It's more about the big picture over a long period of time. When your body gets more carbohydrates than it needs for immediate energy, and that can be from grains, not just sugar, it stores the extra as fat. Now do that for years and years, combine it with not enough physical activity, and what happens? Those locks on your cells start to get jammed. That's called insulin resistance, and that is what ultimately leads to type 2 diabetes.
So this all leads to probably the most important question anyone can ask about this condition. Once you have it, is it possible to cure it?
And the honest answer, based on the science we have today, is no. There isn't a complete cure. But, and this is a really, really big but, it can absolutely be managed and controlled. With the right knowledge, the right diet, regular exercise, and medication or insulin if you need it, you can live a long, healthy, and completely full life.
And that word, control, is everything. It's not just a nice idea, it's essential. Because we have to ask, what happens if diabetes is just left to run wild over the long term?
The long-term impact is serious. You can think of having high blood sugar all the time as being really damaging to your blood vessels, like rust forming in your body's pipes. After maybe 8 or 10 years of poor control, that damage really starts to show up. We're talking about major risks to your heart, your kidneys, your eyes, even your limbs. This is exactly why managing it and keeping it under control matters so much.
So, we've talked about the problem, the genetic risk, the modern lifestyle, and the serious consequences. It can sound a bit overwhelming, right? But the solution, the path forward, starts with one simple, incredibly powerful idea.
And this, right here, is what I really want you to take away from our time together. It's true that a combination of our genes and our environment can lead to diabetes. But the single most powerful tool we have to fight back isn't some miracle drug. It's knowledge. Understanding your own body, your risks, and your options. That is the absolute best way to take control. So the question isn't just, what is diabetes? The real question is, now that you know, what are you going to do about it?